There's a question a lot of women over 50 are asking right now. Not out loud necessarily, but in the quiet moments after a hard week, after a doctor's appointment that didn't go the way they hoped, after a morning when the body just didn't cooperate. The question is this just what getting older feels like? Today I want to share something from a physician who's asked herself that same question and found out she was wrong. I'm your host, Susie Rains, and you're listening to Health Over Wealth in the U.S., the podcast that helps Americans find cash-based, client-centered care outside the traditional insurance system. Dr. Townsend is an orthopedic surgeon-trained physician who now practices what she calls health optimization medicine in Townsend Clinic in Westchester, Pennsylvania. She spent 21 years fixing musculoskeletal breakdown, and then she turned 50 and realized the most powerful intervention wasn't repair, it was prevention. This article is her personal story and her clinical perspective, and it speaks directly to women in their 50s who have started to wonder whether decline is just inevitable. I want to name here that I myself, the host of this podcast, is in my 50s as well. Adrian's story really resonated with me. Health Over Wealth in the U.S. is produced by the Centered Care Directory for educational purposes only, not medical or financial advice. Always consult a qualified healthcare professional for your specific situation. When Dr. Townsend turned 50 in May of 2021, she didn't want a party. She had celebrated 30 and 40 without hesitation. But 50 felt different, like a threshold she didn't want to cross. Her daughters convinced her to do it anyway. They were just emerging from the pandemic, and they invited 50 people to celebrate 50 years. Every single one showed up. The party was wonderful, but her mindset kept seeing 50 as the beginning of getting older, slowing down, and watching the best years move further into the rearview mirror. At 55, she says she feels stronger, healthier, and more optimistic than she did 5 years ago. Not because aging stopped, but because she stopped waiting for it to happen to her and started making deliberate choices about how she was going to live. So what did she do? After giving in for a while to the narrative that menopause and decline were just her new reality, Adrian did a major reset. Here's what she changed. She prioritized strength training, improved her nutrition, optimized her sleep, and paid attention to her hormones. She challenged herself physically, and she reset professionally as well. And guess what? None of it happened overnight. None of it required a dramatic overhaul. What it required was a shift in belief that her body was still capable and that it was worth investing in. What she has learned, both from her own experience and from working with patients at Townsend Clinic, is that your 50s are often the most important decade for long-term health. Not because everything falls apart, but because the choices made in this decade can dramatically shape the next 20 to 30 years. What does healthy aging actually look like? The biggest misconception she sees both in her practice and in the broader healthcare conversation is that aging after 50 is primarily a medication management problem. Guess what? It isn't. Medication has a role. The most powerful levers available to women in their 50s aren't pharmaceutical. They're lifestyle-based. I'm going to say that again because I think for some of you listening, we're just in the habit of thinking when you get older, it's all about medication. The most powerful levers available to women in their 50s are not pharmaceutical. They're lifestyle-based. She breaks it down into 5 areas. Strength training. This may be the single most underutilized tool for women over 50. Building and maintaining muscle mass directly influences metabolism, bone density, balance, and quality of life well into your 70s and 80s. A systematic review published in PMC found that resistance training 2 to 3 times weekly significantly improves bone mineral density in postmenopausal women, including those already diagnosed with osteoporosis. As someone who spent 2 decades treating musculoskeletal breakdown, Dr. Towson says she cannot overstate how much of that breakdown is preventable. The next section, nutrition. This changes as we age, not in a way that means eating less and enjoying food less, but in a way that requires more intentionality with protein, blood sugar stability, and inflammation. Small, consistent adjustments compound over time in ways that medication rarely replicates. And the next thing to think about, sleep. Sleep is not a luxury. For women navigating perimenopause or postmenopause, disrupted sleep has a downstream effect on hormones, cognition, mood, and metabolic health. Addressing it directly, rather than accepting it's inevitable, changes the picture entirely. The next section is a big one. A lot of people are talking about it. Hormones. This is the area where she says the most women have been dismissed. Many are told their symptoms are just part of aging, when there are evidence-based options worth exploring. If that has been your experience, it may be worth seeking out a practitioner who specializes in this area and will take the time to actually look. At how.healthcare, you can search for practitioners in the United States by location and specialty, including those who focus on women's health and hormone optimization. And the last but not least, the mindset. Dr. Towson is clear that mindset is not soft, it is clinical. The belief that your body is capable, or the belief that it isn't, has measurable effects on health outcomes. Women who expect decline often experience it. Women who invest in their health at 50 often find that the next decade surprises them. So why hasn't your doctor talked about this? This is one of the most common questions that come up when people start learning about lifestyle medicine, and the answer matters. The traditional healthcare model gives the average patient 15 minutes per visit. Research published in the Journal of General Internal Medicine found that clinicians consistently reported needing significantly more time than they were allotted, particularly for patients with complex or overlapping health concerns. For women in their 50s, navigating hormonal shifts, fatigue, changing body composition, and sleep disruption, 15 minutes is not enough time to be heard, let alone treated. The insurance system is the structural cause. Reimbursement models reward volume over depth. Practitioners who stay in network are incentivized to see more patients in less time, which means the conversation about strength training, sleep, hormones, and nutrition simply doesn't fit. Not because your doctor doesn't care, but because the system doesn't pay for it. Lifestyle medicine, the kind that actually changes outcomes, requires conversation, context, and a follow-through over time. That cannot happen inside a billing code-driven appointment. So here's the goal. Dr. Towson is direct about what the goal of all this actually is. It is not to reverse aging. It is not to look or feel the way you did in your 30s. The goal is to be strong enough, healthy enough, and capable enough to fully enjoy what's ahead. For her, that looks like continuing to travel, competing in ballroom dance, growing her clinic, celebrating her daughter's wedding next year, and one day, playing with her grandchildren. This is her list. Yours will look different. But the point, and this is what she wants every woman in her 50s to hear, is that you get to have one. Your 50s are not the beginning of the end. They are an opportunity to decide what the next chapter looks like. If what Dr. Towson shared resonates and you're looking for a practitioner in the United States who approaches midlife health the same way, cash-based, outcome-focused, with time to actually address what's happening, you can search by location and specialty at how.healthcare. The search is free. This podcast episode was recorded based on the full article by Dr. Adrienne Towson, which was published in the Health Over Wealth in the U.S. newsletter. I will put a link in the show notes so you can read the full article written by Dr. Towson. If this episode was useful, follow the show so you don't miss the next one. And if you know a woman in her 50s who's quietly asking the same question, is this just what getting older feels like? Share this episode with her. She deserves to know the truth.